Before entering the room, I'm going to make sure that I have all of my supplies. I'm going to make sure that I'm wearing a face mask and face shield. I have my trach kit, I have my suction catheter, my disposable container, my inner cannula, my sterile saline, and my trach stabilizer. So now that I have my supplies, I'll enter the room. Knock, knock, knock. Upon entering the room, I'm going to perform hand hygiene for a full 20 seconds. Good afternoon, Mr. Jones. My name is John Michael Lozada, and I'll be your student nurse today. Now I understand that you're having difficulty speaking, so if I could have you give me a thumbs up for yes, a thumbs down for no. You can also raise your hand if you have any concerns or if you're feeling any pain or discomfort. Is that understood? Thumbs up, very good. Now Mr. Jones, if I could have you confirm that your full name is Jim Jones. Thumbs up, all right. And if I could have you confirm that your date of birth is March 10, 1994. Thumbs up, very good. Let me go ahead and scan your armband. Okay, that matches. Now, Mr. Jones, do you have any allergies? Thumbs down. Are you experiencing any pain at the moment? Thumbs down. Okay, Mr. Jones, today we are going to be suctioning the secretions from your tracheostomy or the opening in your neck. We're also going to be switching out your inner cannula. We're going to be assessing and cleaning the site to prevent infection. We're going to be switching out your dressing, and finally we're going to be switching out your neck stabilizer. Now, do you have any questions or concerns about today's procedure? All right, thumbs down. So have you had this procedure done before? Thumbs up. So you have a pretty good overall understanding of what we'll be doing today. Thumbs up, very good. Let me go ahead and check your vitals. So it looks like your blood pressure, heart rate, and temperature are within normal limits. Your respiratory rate is at 20. Checking your oxygen saturation. It's in the low 90s, hovering around 91, 92. But the suctioning should help out with that. Now, Mr. Jones, do you have any shortness of breath or difficulty breathing? Thumbs down. Any coughing? Thumbs down. And I do notice you're not using your accessory muscles to breathe, so you're not exerting any extra effort, so that's good. Mr. Jones, is it okay if I go underneath your gown to listen to your lungs? Thumbs up. Thank you so much. So I've already cleaned my stethoscope before entering the room. All right, I'm going to go ahead and have you give me a good deep breath in and out. 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 Okay, thank you so much. Now, Mr. Jones, I do notice you have a bit of gurgling in your upper airways, but once again, the suctioning should help out with that. Now, I'm going to make sure that I have all of my emergency bedside equipment on hand. I'm going to make sure that I have two extra trachs, one size down, a size 6, and one matching his current size, a size 8. I'm going to make sure I have extra inner cannula. I have my ambu bag attached to my oxygen supply running at 100% oxygen. I have my suction catheter attached to my suction canister running at 120 milligrams of mercury. So now that I've ensured that, I can perform hand hygiene, 20 seconds, and don a pair of clean gloves. Okay. So I'm going to begin to prepare my work area. I'm going to start by wiping down the tabletop for a full 30 seconds, starting now. All right, now Mr. Jones, before we begin suctioning your secretions, it's really important that we hyperoxygenate you. And by that, I mean I'm going to apply 2 to 3 breaths. That way your oxygen level is maintained throughout the duration of the procedure. Is that understood, Mr. Jones? Thumbs up. Do you have any questions or concerns? Thumbs down. Very good. Okay. All right. I'm going to allow that to dry for a full 2 minutes. Okay, 2 minutes has passed. I'm going to grab my supplies, place them on the table. I'm going to doff my gloves, perform hand hygiene. I'm going to go ahead and close the door and close the curtain for some privacy. I'm going to place you in a semi-Fowler's position for easier breathing. All right, I'm going to perform hand hygiene once again and don another pair of clean gloves. You doing okay, Mr. Jones? Thumbs up, very good. All right, let's go ahead and switch out your suction catheter. And while I'm here, I'm also assessing the function, making sure the suction works. All right, that works. I'm also checking the function of the amber bag. That works as well. Now that I've checked that, I'm gonna go ahead and open my trach kit. Making sure to only touch the outer edges. I'm gonna grab my sterile gloves if you don't need that. I'm gonna grab the sterile drape. Making sure to only touch the outer edges of a 1-inch margin. Okay, and we're gonna place that just in case the inner cannula drops, it has somewhere to land. Okay, now that I've grabbed that, I'm gonna go ahead and drop in the new inner cannula. And gently place it inside the box, like so. I'm gonna grab my sterile saline. Actually, I'm gonna open up my box. Grab my sterile saline and fill that up about halfway. Also fill up the trach kit as well. Now that I've done that, doff my gloves, perform hand hygiene, don another pair of clean gloves. All right. So now, Mr. Jones, I'm gonna go ahead and hyperoxygenate you. Again, if you feel any discomfort, please let me know. As I remove his oxygen supply, I'm making sure I stabilize the faceplate. Okay. I'm going to apply 2 breaths and waiting 6 seconds in between each breath. I'm gonna stabilize the faceplate. Okay. 1 breath. 1, 2, 3, 4, 5, 6. 2 breaths. Okay. All right, stabilizing the faceplate as I remove. All right. And I'm also taking note of the oxygen saturation. I do notice it went up to 98%, so that's good. So now I'm gonna go ahead and begin suctioning. I'm gonna make sure the suction is working by suctioning out some of the sterile saline. Okay, it's working. Okay, now Mr. Jones, I'm gonna begin suctioning you. You may feel a little bit discomfort, so I apologize about that. All right, starting now. Okay, Mr. Jones, do you require any more suctioning? Thumbs down. Okay, if you required any more suctioning, I would wait a minimum of 30 seconds in between each suction. And I also do notice that his oxygen saturation is still at 98%, so there's no need for any hyperoxygenation at this time. But if it was anything lower than that, I would give him oxygen. So I'm gonna go ahead and grab a little bit more sterile saline here to clean it. Okay, I can put that away. I'm gonna place his oxygen back on. All right, I'm gonna doff my gloves. I'm gonna perform hand hygiene 20 seconds and don another pair of clean gloves. You doing okay, Mr. Jones? Any pain? Thumbs down. Okay, very good. Okay, now I'm gonna remove his oxygen, stabilizing the faceplate. Okay, I'm gonna grab his old inner cannula, making sure to only touch the tip. Grab his new inner cannula, and gently place it in until it clicks. Like so. Okay, now that I've done that, I can go ahead and remove the dressing. so. Mr. Jones, do you have any respiratory distress at the moment or any shortness of breath? Thumbs down. Any coughing? Thumbs down. Very good. Your oxygen saturation is still at 98%, so that's good. I'm also going to be assessing the site for any redness or inflammation, any swelling. Everything appears to be normal. I'm also checking the trach itself, the faceplate, making sure everything is intact, nothing is cracked, so everything appears normal. Finally, I'm also checking the stabilizer itself for any tears, any rips, so everything looks good. So now that we've done that, we can begin cleaning. So I'm going to start by grabbing the Q-tip. I'm going to dip once in the saline. Begin cleaning the bottom. Dip. I'm going to clean the top. Dip. I'm going to get one wet gauze. Wipe the top. Finally, wipe underneath as well. Finally, I'm going to grab a dry gauze and pat it dry. Pat, pat, pat. Pat, pat, pat. All right. That way there's no moisture. Okay. Finally, going to grab the split gauze and apply the new dressing. Like so. Okay, so now Mr. Jones, now that I've applied your dressing, I'm just checking up on you once again. Are you experiencing any pain, any discomfort? Thumbs down. Okay, I'm gonna go ahead and replace your oxygen. I'm gonna doff my gloves. I'm gonna perform hand hygiene and get rid of my supplies. Perform hand hygiene once again. Okay, now Mr. Jones, I'm gonna go ahead and switch out your neck stabilizer, but I'm gonna grab my second nurse to do that, so I'll be right back. But before I go, I'm gonna put your call bell right next to you. I'm gonna put both your side rails up, put your bed in lowest position, and looks like your surroundings are pretty safe. So yeah, I'll be right back. Perform hand hygiene once again. And yeah, I'll be right back, Mr. Jones. Knock, knock, knock. All right, we're back, Mr. Jones. I'm gonna perform hand hygiene, 20 seconds. All right, I'm gonna don a pair of clean gloves. All right, I'm gonna have my second nurse come in now, and I'm gonna have her perform hand hygiene and don a pair of clean gloves as well. Thank you. I'm gonna dispose of the sterile drape. We won't be needing that anymore. All right, okay. Now before I remove your oxygen source, I'm gonna assess your vitals once more. Everything's within normal limits and your oxygen saturation is at 98%. Okay, I'm gonna stabilize your faceplate, remove your oxygen. Okay, and I'm gonna have my second nurse stabilize her side as I remove my side. Okay, I'm gonna grab the new stabilizer. Underneath. Okay. Now, Mr. Jones, is it okay if we turn you on your side? Thumbs up. Okay. Now, while I'm back here, I'm assessing his neck for any redness or inflammation, and everything seems to be clean, dry, and intact. I'm going to slip that under. Now, Mr. Jones, we're going to go ahead and put you back down gently. All right. Okay. And as I stabilize my side, my second nurse is going to fix her side. Are you doing okay, Mr. Jones? Thumbs up. All right. Any pain? Thumbs down. Okay. Thank you. I'm going to dispose of the old stabilizer. All right. Wasn't too bad, right? Okay. Mr. Jones, we're pretty much done. I'm going to replace your oxygen now. All right, thank you, nurse. I'm gonna doff my gloves. I'm gonna perform hand hygiene, 20 seconds. Gonna don another pair of clean gloves. I'm going to replace your suction catheter with a new one. All right. Okay. Now, Mr. Jones, are you once again? Are you in any pain? Thumbs down. Do you have any questions or concerns? Thumbs down. Okay. Now I'm gonna go ahead and assess your vitals, if that's okay. Let me go ahead and doff my gloves. Perform hand hygiene. Your blood pressure, your heart rate, and temperature are within normal limits. Your respiration is at 20, and your oxygen saturation is at 98%, which is good. Now, Mr. Jones, once again, do you have any shortness of breath or difficulty breathing? Thumbs down. Do you have any coughing? Thumbs down. And I notice you're not using your accessory muscles, so no extra effort in breathing, so that's good. Now, Mr. Jones, is it okay if I listen to your lungs underneath your gown once more? Thumbs up. All right. Once again, I already cleaned my stethoscope. I'm gonna go ahead and listen to your lungs. Give me a good deep breath in and out. 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 Very good. Now, Mr. Jones, your lung sounds are clear and equal bilaterally, so that's good. Okay, Mr. Jones, I'm going to go ahead and perform a hand hygiene once more. And I'm going to put your call bell right next to you. I'm going to put both your side rails up and your bed in its lowest position. So that's pretty much it, Mr. Jones. If there's anything else you need, let me know and I'll come and assist you. So as I exit the room, I'm going to make sure I document the date and time, the patient's tolerance of the procedure, which was pretty well. He experienced no pain. He had no concerns. The assessment of the stoma, there was no redness, no inflammation. The site was clean, dry, and intact. And the sputum was minimal thin white secretions. And the vitals were within all normal limits, especially his O2 saturation was 98%. And he experienced no respiratory distress, no shortness of breath, no difficulty breathing, and no coughing. Thank you.